Okay, welcome to everyone. Once again, we're just going to start in a minute. We're just giving a few more minutes for people to come in, but we're excited to have you, so welcome. Okay, so we're going to get started. I want to welcome everyone to tonight's presentation. Hopefully you can all see my screen. So tonight is a presentation on vaccinations for COVID-19. For anyone who's not from our school community, I just wanted to introduce Equality Charter School. We are a 6th through 12th grade school in the Bronx. Our middle school is located in Section 3 of Co-op City, and our high school is in Castle Hill. We do have an elementary school that's opening in 2023, so we hope to have details out about that soon, and our website is there if you would like more information on equality. So I'm just going to introduce who you see here tonight and who you'll be hearing from. So my name is Caitlin Franco. Welcome. I'm the Executive Director of Equality Charter School. It is my 12th year at Equality, and I do want to point out I have the Moderna vaccination. Next tonight, we have Jason Caraballo. So he's worked at Montefiore in the Bronx for over 8 years. He's the community relations manager. He's been really helpful in getting tonight set up for us, and he's been a great community partner. And so we're so lucky to have him here and have his support. And just to note, Jason also had the Pfizer vaccination. The last person you'll be hearing from a lot tonight, Amanda Huza. She is the moderator of tonight's event. She's our middle school principal. She's been at Equality for 10 years, and she had the Moderna vaccination. And our honored presenter tonight, so Dr. Gracie, we're so happy to have you here. Dr. Gracie, MD, MPH. She's received the Moderna vaccination. She's a practicing pediatrician and the Director of Clinical Services for the School Health Program of Montefiore Health System, which is the largest and most comprehensive school-based health program in the country. We are so honored to have her here. She speaks at many different places, academic conferences, mainstream media, congressional briefings, and now Equality Charter Schools, vaccination presentations. So we're really lucky to have her tonight to speak to you, and you'll be hearing more from her in a minute. So she's really, really impressive, and I'm happy that she's here with us. And last but not least, we have a special guest. So I would like to introduce Assemblywoman Carinas Reyes, who has been a phenomenal partner of our school. She is our local Assemblywoman. She's been in the Bronx for almost 20 years. And something I want to take a minute to highlight is first, she helped us get this event kicked off. She connected us with Montefiore. We went to her and said, we are trying to get a vaccination webinar put together. Can you help? And like she always does, she jumped up and connected us and helped us out. And something I wanted to stop and acknowledge is that her background is in nursing, and I highlighted it in yellow on my PowerPoint. That's how impressed I am with this. I wanted to share that, you know, during the pandemic, she returned to her roots as a nurse to help out her community. And I think that's something that, you know, you have a lot of elected officials who say they're here to serve their community, but to have someone who actually rolls up her sleeves and gets down and dirty to serve her community is rare and something that is really admirable. And so we wanted to start tonight. She's going to give us a few words just about the importance of the topic we're talking about tonight before we launch into our presentation. So Carinas, I am going to turn it over to you.
Thank you so much, Caitlin. It's always a pleasure to speak with you and the equality community and students, and of course the overall community that's going to be joining us and perhaps watching this webinar at some point, because I know we are recording. You know, for me, this has been a very difficult year, like it's been for many of you. And I unfortunately have witnessed firsthand how COVID has affected and unfortunately taken the lives of so many of our community members. I am a registered nurse by profession, and of course, late last March, when we were in the height of the pandemic, I went back to work, and I have been working since. And I have to tell you, I was working recently and we still have COVID positive, full COVID floors in the hospital. And even though the numbers have been decreasing, this is still very real and very much affecting our communities, particularly in the Bronx and in neighborhoods that we all serve and live in. I am actually fully vaccinated. I was vaccinated in January as a first responder. I have the Pfizer vaccine. And I am, not just because I am a nurse, but because I'm a person who believes in science, but the nursing profession is evidence-based. And the evidence and the science has shown us that vaccines work. They have worked for generations. It's the reason why we were able to eradicate polio and measles and all those things. And unfortunately, some of those have started to come back because there have been some people who haven't been getting vaccinated, but vaccines are overall safe and they're effective. And we want people to be as informed as possible so they can make the best decisions for themselves. And I think this is the purpose of this webinar. And now that we have opened up eligibility for children over 16 years, who are 16 years and older, I think that there are going to be many students in your school who will also be soon eligible to get vaccinated as well. And it's important for them to understand how important it is for them to do their part to really make sure that we overcome these very difficult times. And that means that all of us have to do our part and make sure we get vaccinated. So I have to thank Dr. Gracie and Jason, and of course, Principal Husa and Megan, who has always been so great for their presentation and for putting this together. And I hope that people leave here with more information that they came in with. So thank you.
Thank you, Assemblymember Reyes. We really appreciate you coordinating this and helping us to get this very important information out to our community. So thank you for being with us here tonight and setting up these contacts. Dr. Gracie, I'm going to get ready to screen share the awesome presentation that you put together, and then we'll segue into the questions that were submitted during the registration process. And then you'll have the opportunity to answer those questions. Before I do that, I did want to just give a special shout out to all of our participants on tonight's call, from Ms. Ramsey, our parent liaison. She's sorry she couldn't be with us here tonight, but she's actually taking all of her children who are over the age of 16 to get vaccinated, and their appointments were this evening. So that's why she's not with us, but she wanted to tell staff and family that she's here if you have any questions. And so, you know, obviously she's a proponent for our school and wants to make sure that everyone has the best information possible. So without further ado, let's screen share. Thumbs up from the panel if you can see the presentation. Awesome. All right, Dr. Gracie, the floor is yours.
Okay, excellent. Hi, everybody. Thank you for coming on, I think it's Wednesday night. It means a lot, really, that your school is bringing this to you and that you're engaged and you're looking for information. So we appreciate you coming here to spend a little bit of time with us. You can go to the next slide. So what we're going to talk about tonight, I'm just going to give you a few slides so we all sort of start in the same place with a little bit of basic knowledge, and then we'll spend the vast majority of the time doing question and answer, so we make sure that we get you what you want to know. So we'll give a little overview of the pandemic, of where we are now, a little bit of an overview of the vaccines. How are they different? How do they compare? We'll talk about reasons that you would consider getting it, reasons that you might be considering not. We'll go through all of those things, and we'll talk at the end to just make sure that you know where you can get it if and when you are ready to get it. So we'll go from there. So this slide looks a little busy, but I really just wanted to make a couple of points with these first two slides. So if you see the one in pink, thank you for making that bigger. The one in pink is new cases, and the time span is the whole year. So, you know, it's been since last March that really we've been dealing with this. This first slide is about the United States. And it's good for us to remember that there is still so much going on with COVID, and it is not done. This pandemic is not over. So we all have to still take it really seriously because we have a lot of work left to do. Obviously, it feels so much better than it did this time a year ago, but this is where we have to be careful that people don't stop doing all the things we need to do to stop the pandemic because it feels a little bit better. So nationwide, you know, over 60,000 people still get COVID every day. And about 1 in 10 people in the United States have been infected. Some of them got very, very sick. Some of them didn't. But that's a huge amount of people in a general population the size of the United States. And 1 in just under 600 have died. And I want you to remember that when we talk a little bit about vaccines and risk and things that people worry about, the risk from COVID itself is extremely high. And a lot of people who get it do get very, very sick and unfortunately die. And probably most of us have had our lives impacted by that personally. So it's a tough thing to talk about and a tough thing to remember, but we do need to maintain our vigilance because it's still very much going on. If we go to the next slide, we're looking at New York City, and you can see the shape of these graphs are a little bit different. So if we look at the pink one again, that's, that's cases of COVID over the last year. And everybody remembers, if you were in the Bronx, if you were in New York, how bad it was in March and April, and that's that big spike. But if you look at where we are now at the end of that pink graph, it's still way up there. There's still a lot of people getting COVID. So it is still very, very much active in our community and something we absolutely need to protect ourselves, our families, and each other from. If you look at the gray chart, that's deaths. So there were so many in that first spike. And so the good news is that that hasn't re-spiked to the degree that the number of cases have. So at least we're managing it better. And there's a lot of reasons that people are overall doing better, but the vaccine is one of those major reasons. Before I go to the next slide, I'll give you a little bit of context on me and why I feel so passionately about this as well. I'm a pediatrician. I work with the schools. We have programs across the Bronx. And, when all of this happened, all of the schools closed and all of my staff went to work in the hospitals. Our nurses were in the ICUs. We had people working in the morgues. We had people working on iPads to help people talk to loved ones who couldn't come see them. It was horrible. It was really bad. I didn't see my own daughter for 50 days. I have a 13-year-old. And we never want to go back there again. And we have this amazing opportunity to really manage this pandemic. And the vaccine is really the major way we can do that. We'll talk about some other things that we can do, but it's incredibly important. So I just want to make that point that we're not done yet, but we can be. There's so much we can do, and the vaccine is a big part of that. So if you go to the next slide, a lot of people have gotten the vaccine. And I don't know if you had heard this week, as of maybe even yesterday, the whole country now, anybody that's an adult 18 and over is eligible. So, in the beginning, it was if you had certain conditions, you could get the vaccine, or if you had certain kinds of jobs, but now all adults are eligible. And as the Assemblywoman said, even with one of the vaccines, 16 and over are eligible. So that's great that it's out there. And if people want it, you're now eligible. So that's the first step. So far where we are now, in our population, is kind of midway down the chart, population 18 plus years of age, 33.8% of people are fully vaccinated. That means if they got a vaccine that requires 2 doses, they had both of those doses and they're considered fully vaccinated. And, if you look at those who've only gotten 1 dose so far and add those in, it's about half of the population. And you probably heard in the news, people talk about herd immunity a lot. And the more people around a community that are vaccinated, it helps protect everybody, even the people who aren't, because the vaccine just can't pass person to person as quickly or as easily. So we're doing well. And they tend to talk about herd immunity being reached where it really becomes protective around 70 to 80%. So we're making nice progress in that direction. But again, at numbers like 50%, we're definitely not there yet. If we go to the next slide, and over 200 million doses have been given now nationwide, which is pretty amazing. So I think we're making a lot of progress, and there's so many reasons for optimism. You know, we just have to stay vigilant, and we have to make sure we're doing everything we can. So the 3 vaccines that are out there right now, I'm sure you've heard: Pfizer, Moderna, and Johnson & Johnson. Pfizer and Moderna, they require 2 doses, Johnson & Johnson 1. You may see in the news that a lot of them think that they may require boosters at some point. So that's certainly a possibility, almost more like the flu shot, where you get a booster every now and then, or especially if the vaccines tend to have different variants. Johnson & Johnson is 1 dose right now, but they are doing some clinical trials on a 2-dose version to see if that works better. As far as the vaccine type, I won't go into that now, but if anybody wants to talk about it at the end, we can certainly do that. But there's a couple of different ways that they work. But basically, like any vaccine, they teach your body how to respond really quickly to a virus. So if you then get exposed to the real virus, your body already has the antibodies, so it can protect you very quickly and you don't get sick, as opposed to the first time that you're exposed to a virus, you get very sick because your body's just never seen it before. And that's what the issue was with COVID, is nobody's body had seen it before, so nobody had any protection. You see in effectiveness, there is a range, and some of it depends on how the studies were done. But Moderna and Pfizer with their 2 doses are, 94 to 95% effective. The Johnson & Johnson is lower, but keep in mind that in these studies, and each of them had about 30,000 people in them, even though Johnson & Johnson is lower, people who did get the disease did not get nearly as sick, and there were no deaths and much lower rates of hospitalization. So even though it's not quite as high in the others of completely preventing it, still totally worth doing if that's the one that you have access to, because it's been great at stopping people from getting so sick or dying from COVID.
Dr. Gracie, sorry, before we go to the next slide, I just want to remind everyone, we did have 1 question submitted. At the bottom of your screens, you'll see Q&A. You can submit additional questions there that maybe you didn't have a chance to submit during the registration process, that maybe you have now that Dr. Gracie is presenting this information. Those questions only appear and they will be sent to us anonymously.
Okay, so, you may have talked about this with your family or your doctor or your friends, but why would you get the vaccine at all? Number 1 is to keep you from getting sick, and the studies have shown that they're very, very effective at keeping you from getting sick or getting very sick if you are exposed. Definitely to also help keep your family and community from getting sick. That was one of the main reasons that I wanted to get it, to make sure that I'm keeping my daughter safe, and that everyone I'm around, that even though I work with people in the healthcare system, that I'm not then exposing others in my life to that I'm not increasing the risk for others. Definitely to help keep schools open. We all know it's been a challenging year with schools open and closed. It's important for the kids to be able to be together as much as possible for their development, their social experience. So as much as possible, we would like the world to feel as normal as it can for them, and for them to have those experiences in sports and clubs and all those things that are really enriching for kids. And the more vaccines we can get, the quicker we can get to things like normal. It is safer to travel. My father's turning 80 in December, and I'd like to go there. I'd like to take my child. So us all being vaccinated was a huge factor in us feeling like we'll be comfortable for that. And I'm hoping that they'll have one for my daughter's age by the time that we go. She's 13, and so the odds are pretty good for that. There are some side effects, and we can talk about those later. Most are very mild, but it doesn't mean you're sick if you get them. And we'll talk about the higher risk ones and the ones that have been in the news, like blood clots, a little bit in a minute. Vaccine development was fast, but it didn't skip steps. People ask about that a lot, and we can dig into that more if you like. But what they did for these vaccines was they did a lot of the steps all at once instead of one after another through time, because it was so urgent that we needed to reach people. So for example, usually when you start a vaccine trial, you would use about 3,000 people in your first trial. Each of these had 30,000 people in each trial. So they got it to much larger groups, much faster, to make sure across a lot of different people that you weren't seeing, different kinds of reactions or things you didn't expect. And they also began the manufacturing before the approvals were completely finished. Normally you wouldn't do that, but it was such a desperate need that some of the bigger pharmaceutical companies did take that step. And so that's why as soon as they got approved in December, we were able to start giving them the next week. But that's because they overlapped some of the steps you normally wouldn't do. So it went fast, but they didn't skip safety steps. So it's really important to understand that, because a lot of people think that it just wasn't tested well or steps were skipped, and that's not how it worked. Just a lot of things were done at the same time, and there was a lot of support in companies working hard to get it fast. Some people worry that they'll get COVID from the vaccine. That does not happen in any of the ways that it's made. You can get the side effects, we can talk about that, but you will not get COVID from the vaccine. Some concerns with people with allergies, can they still get it? And most of them can. If you're pregnant, you can talk to your doctor. A lot of times it is recommended for pregnant people, but it's case by case. And that's the thing, is getting COVID is extremely high risk if you're pregnant or even if you're not. So most of the time the risks outweigh, the benefits of getting the vaccine outweigh the risks of not, because the risks of having COVID are much higher. And if you've already had COVID, the vaccine is still recommended that you get it, because there are the different variants out there. And we want to make sure people are as protected as possible, and it gives your immune system that little boost. So if we go to the next slide, and again, I want to do this part pretty quickly so we can really dig in on the questions that are the most important to you, and so we can, go more into this as much as you guys like. Common side effects are, you get pain in the arm where you had the shot, you can have some redness, you can have some swelling, tiredness, headache, muscle pain, fever, nausea. You can certainly have those things. That is not COVID when you get those things, and it actually means your body is responding, and that it saw the vaccine, it recognized the vaccine, and it's making those antibodies to fight it, and so that your body will be ready if you actually do get exposed to the actual virus. So there's been a lot in the news about blood clots, specifically with the Johnson & Johnson vaccine, as well as there's an AstraZeneca vaccine that's not available in the States, but is in Europe. And what happened was, fairly recently, there were 8 people that had very serious life-threatening blood clots within 3 weeks of when they got the Johnson & Johnson vaccine. And so that's why that vaccine is on pause for being given right now. It may be restarted as early as end of this week, and it was restarted in Europe because with the assessments, it's found that the risk of getting COVID and dying from COVID are so much higher than the risk of getting a blood clot. So, it's less than 1 in a million of getting a blood clot from the vaccine, whereas we remember that it was, numbers like 1 in 600 risk of dying from COVID. So it's really important to keep those numbers in mind by comparison, that it is a real risk, and it's something that everybody should consider, and especially if they have a history of blood clots, and you should talk to your doctor and all of those things. But 8 out of millions of people, 7 million people that have gotten that vaccine. So it's extremely, extremely rare. So you are at much higher risk to catch COVID and to die from COVID than you are to have a blood clot from this vaccine. So just want to make sure to put that out there. There's a lot we can still do to protect our communities, our families, ourselves, that we really should do, especially with regards to school and work. If you're sick, even if you have the sniffles, you really shouldn't go be around a lot of other people, because as we know, a lot of people have very mild cases of COVID, but you can pass it to somebody else who can get very, very sick. So it is really important to take this seriously. So whereas usually sometimes you try and tough it out if you have a little cough or a little bit of sniffles, but we shouldn't be doing that now. Masks are one of the most important things you can do. You have to wear them well. They have to go over your nose to really protect you and others, but that is incredibly important, as is the hand washing and social distancing. So those things are still front and center, and we all do need to still be very vigilant about doing that. And even if you're vaccinated, if you're around other people who aren't, we still need to be doing these things. And I think this is the last slide. If you want to get the vaccine, a lot of people's regular doctor's offices have it now, or local hospitals, health systems have it now that you can schedule directly through them. But if you aren't connected with a system that does, you can just Google New York City, Department of Health, am I eligible? And it will take you to a website that lists tons of them, and you put in your zip code and it shows you what's around in your area and phone numbers and contact information. So that's a quick way to find some options that are close to you if you're looking to get it in your regular place where you get healthcare doesn't offer it.
All right.
Go to the next one.
I think we're
That's
ready we're on to Q&A. So thank you so much.
Perfect.
That was such
Sure.
good information. And actually, Dr. Gracie, you covered some of the questions that were included during the
Good.
registration process. So when I see any of those, I'll just refer everyone back to the presentation, which will go out to anyone who was on this call and anyone else who couldn't make it with us today. So here we go. So these are the questions submitted during the registration process, and we've categorized the questions. And so this section here is all around vaccine creation. It seems like this first question here, Dr. Gracie, you responded to in regards to the short period of time between when we started working on the vaccination to when it rolled out. I think the one question that I see in here that we can still maybe have a little bit more information on is what is the evidence in terms of the testing and whether or not the vaccinations are safe? Was there enough testing in your opinion?
Right. So, as I said, the studies from out of the gate were so much bigger than usually would be done in an early study for any medication or a vaccine. So, yes, the studies were very, very thorough. And the way those studies work is you get a group of people and half of them get the vaccine and half of them don't. But, the people who don't get an injection basically of salt water. So nobody knows who had it or not. And then you follow those people through time. And then you compare of those two groups, how many people got sick, how many people were hospitalized, what happened. And so in these studies that were done all over the world, most of the ones that we talked about had people from multiple countries in them. They tried, I think, harder than they ever have with prior vaccines to really have diversity in age and gender and race included in the testing. Because as we know, it's not always exactly the same. And I think, hormones and, we're learning more every day about what can make it different. And that's why that hasn't just come out for kids yet, because they're doing some additional studies for younger people. But the testing was extensive, and they're still continuing to do more testing and following it. The CDC has a thing called Be Safe. So they always offer it to you if you got the vaccine, where you put in any side effects you've had there, and they text you regularly and ask you how you're doing. It's every day in the beginning, and then it's every week for a while, and then every month. And so they're also collecting a lot more information that way, just on these millions of people that have gotten the vaccine as we're moving forward. So, I am really comfortable with it as a doctor, as a mom. I will give it to my daughter when it comes out for sure, because again, the risk is, there is risk, and everybody needs to make their own decision and, do what makes sense for you and your family. But, the science is strong that the risk of getting COVID and getting very sick from COVID or even dying from COVID is so much higher than any of the risks from the vaccines that have been tested. And, the mRNA method is new. So some people have asked about that. These are the first vaccines that have come out that used that. But it's actually been studied for about 10 years. This was just the first situation that came up that was the right match to, give the best protection for the disease. So it's not that was created in a year, that whole science. So there's, 10 years of research behind that science. And some of that science was even with the coronavirus category, just not the specific COVID-19 version of it. So there was a strong base underneath that. So it's new technology as far as a vaccine that people are getting, but it's been in the works for a long time.
Thank you, Dr. Gracie. So since the vaccine is relatively new, how do we know that there are no long-term effects? And do we know that?
That's a great question. And I think, for anything with any new medication, with any new vaccine, we're never 100% sure. And so it's always an assessment of risk versus benefit. And none of the studies so far have shown that. And none of the studies with similar vaccines or the development of the mRNA type vaccine, in the past give us reason to think that there will be. Again, they're not injecting the vaccine into you when you get a COVID vaccine. You get a tiny little part. You know how when you always see the coronavirus picture, it has the little spikes, little pincushion spikes off of it. Those are what your body recognizes to make the antibodies to it. And so what they've done is they basically either take a tiny part of that, of the DNA, or what translates the DNA of that, and that's what they give to you. And then your body knows how to recognize it, but it didn't have the virus. It just had enough of that little piece. So your body learned how to make the antibodies to fight it. And then if you get exposed, you already have those. You have your army ready, and then you don't get sick. Or if you do get sick, you don't get nearly as sick.
Thank you. So are people afraid of getting the COVID-19 vaccine for a variety of reasons? What is the most compelling evidence or strongest reason you could give someone to persuade them to get the vaccine? In other words, why should we get over our fears?
I think it's that there have been a lot of studies that have shown that it works, it's effective, it helps keep people safe. And, from the stats that we started with, COVID is still very, very high rates in our communities, and people are still dying from it. And the best way to not get it and protect yourselves, your family, and your community is to get the vaccine. And if you want to be able to travel and have parties with your family, or attend events, it's the best way to do so safely and to keep the people that you are around safe also. Because as we said, if you're not protected, you can have COVID and not even know it. So you think you're making a safe decision, and you go to a world because you say, I'm not sick, I'm not bringing anything in there. And we've all heard of these super spreader events that it turns out somebody did have it, and then a lot of people caught it from them, and some of them would get very, very sick or even die. So that convinces me that the side effects are so rare that for me, it's well worth the risk, because the risk of the disease itself is so much worse. And I always remember back to how it was last March and all those people in the ICUs, and we don't want to be there again. And I think anything that we can do to heal from that and make our community safe is the decision to make.
Thank you. So can a COVID vaccine make someone sick with COVID-19? You mentioned this during the presentation, that you might get symptoms, but you're not sick with COVID. Specifically, are there blood fragments in the vaccine? That was a question that was posed by a registrant.
Right, and that's a good question, and there are not. And so, as I said, you can get the side effects, which are really from your body responding to the vaccine. So it's not a bad thing. It just may not be very comfortable. I was actually one of those people who did have some side effects. So back in March or April, I did have COVID. I was one of the lucky ones who wasn't very sick. So I had already been exposed to it when I got the first vaccine. So it was essentially my body's second dose. And I did have pretty high fever for a couple of days. But I knew that's what it was. I was happy my body was responding and working, to do what it needed to do to be really, good at fighting it if I were ever to actually, encounter the disease again. So those side effects, again, it's from your body responding and making that immune response. It is not COVID. Those do go away. The ones that are more concerning are those much more serious ones, like the blood clots. But again, you're twice as likely to get struck by lightning than to get a vaccine, a blood clot from a vaccine. It's really, really, really rare. And, COVID is out there so much in the communities. If you're unprotected, it is likely you could get it.
That was a really powerful analogy around the lightning. So thank you for sharing that. Should someone get a COVID-19 vaccine if he or she has had a reaction to another vaccine, such as a flu vaccine?
It depends, and those are really important questions that you should be asked before you get one. For each vaccine, there's a specific list of screening questions, and it depends on what happened. So if you have food allergies or seasonal allergies or most of those things, you can still get it. If it's a moderate risk thing, we just watch you a little longer after you get the vaccine to make sure that you're doing fine. And anywhere that gives a vaccine, everybody has a kit of emergency response medications, just to make sure that we take care of anybody who does have one of those immediate reactions, which once you manage those, they're fine. But I still think it's the way to go.
Yeah, so it's interesting. I have a shellfish allergy, and I remember when I went to take my vaccine, they had me wait 30 minutes after getting the vaccine versus 15 minutes, which is typically how long they have people wait. My sister has multiple sclerosis and takes an intravenous medicine, and she has to take her COVID vaccine at a hospital because they want to monitor her for her allergic reaction, but it's still something that her doctor is promoting. So definitely something to speak to your doctor about in terms of any reactions you may have had.
Exactly. And it's very, very specific to you. So you would want to talk to your provider about your specific condition or the reaction that you had, and they can advise you. So it may be that they watch you a little longer. It may be that they tell you you should, get it in a hospital setting, not the gym of a school or, one of the big clinics. Or occasionally when they recommend that you shouldn't because of a certain condition you have or medication that you take or that you delay it. And, again, the more we can do, people who can get it, we can protect the people who can't.
Makes sense. If someone is pregnant or breastfeeding, should she get a COVID-19 vaccine?
And again, to talk directly to your doctor is the advice on that. Most of the time, they will probably recommend that you do, because again, the risk of getting COVID and the risks associated with that are much higher than the risks associated with the vaccine. But again, it depends a lot on what exactly your personal history is and what's going on with you, but it's definitely worth talking to your doctor about. And vaccine places, if you have that letter from your primary doctor saying that they recommend that you get it, then you can go to a different place to get the vaccine. So
I'm imagining it's going to be the same response for the next question. If someone plans to be pregnant, should she get a COVID-19 vaccine?
pretty much the same thing. Yeah, so it depends on your timing, it depends on your general health, depends on a lot of things that are going on with you. But again, the getting COVID is one of the more dangerous situations you can be in, whether you're pregnant or have a chronic health condition, or any of those things.
Thank you. So you took care of the last question, which was around underlying conditions. So again, that same advice of speak to your doctor. It's going to be an individual case, but again, considering the high risk around COVID and possibly, contracting that. All right. Our next, we continue with vaccine safety. If someone had COVID-19 already, should she or he get the vaccine?
The recommendation is still that you do. And that you probably have heard about different variants on the news. And, it's similar to the flu. The viruses, they can change a little bit, just enough that, if you had it once and then you get a different variant, there is a risk that you could get sick again. And we certainly do see that in the community. The way that the vaccines work, they're more likely to protect you against multiple variants, although there's still, new things in development to, hopefully make them more broadly applicable across, all the variants that we've seen so far. But, again, that will change through time. And that's why, there may be more boosters needed or other things to keep you immune, depending on, how the virus in the community changes. But absolutely, if you got it before, you should still get it. If you got COVID before, you still get the vaccine now.
You mentioned earlier about the studies that they're continuing to do on children, specifically under the age of 16. We saw the chart that said that for Pfizer, it's currently approved for children 16 and above. Mm-hmm. And for Moderna and Johnson & Johnson, it would be 18 and above. So we'll skip to the next question. What are the most common side effects, short-term and long-term, after getting a COVID-19 vaccine?
I'll go back to the one before it because I actually wanted to give you a little information on the vaccines for kids. But again, the most common side effects, like we said, were just the temporary ones that last 1 to 2 days, the swelling or the pain in the area, a little bit of fever, headache. Some people get a little bit of nausea or feel a little bit run down. Those are by far the most common. There were a few episodes where people fainted after getting it. That actually happens with all vaccines. So the numbers, once they've studied them, haven't looked like they were particularly higher than that. So the most concerning one that we've definitely seen is the blood clots. And so there's a lot of work and research going into that one. But again, it was 8 people out of millions who got that vaccine. So obviously incredibly devastating if those things do happen, but again, I know I've said it a million times, the risk of COVID is so much higher, and that can be equally or more devastating.
Thank you. So to
Oh,
go back to the child studies.
Yeah. So Pfizer is the one that's the furthest ahead in the testing of the vaccines for kids, and they actually have put in now for authorization for it for 12 plus. So we may be seeing that in the next couple of months even. And a lot of them are also doing studies in lower age groups. So Pfizer is also studying younger kids. Moderna is studying down to 6 months of age, so even the babies. And Johnson & Johnson is also studying younger ages. So, you know, there's some hope that by even school opening next September, that, you know, a large proportion of kids could be eligible for it. But the next round that we'll see is the 12 pluses.
I know that that's something that comes up a lot with my 11-year-old whose birthday is in July. He is constantly asking, so what's the next age group? So thank you for sharing that information. If taken, how will the vaccine affect someone with multiple sclerosis?
That I wouldn't give a general answer to it, because again, multiple sclerosis, there's a huge spectrum of how that impacts different people, and that can be the stage of your disease, but multiple sclerosis kind of is a waxing and waning condition. So I would say for that one, take it directly to your doctor and have them advise you, because it also depends on what else is going on with you, your general health, what medications you're taking, things like that.
Thank you. So you spoke about the Johnson & Johnson vaccine being pulled due to the low number of blood clot issues that were found. I think this is a great question because it'll help people to norm sort of their understanding of that risk around the blood clots. How bad is the risk of blood clots from the Johnson & Johnson vaccine compared to other medicines?
Very low, actually, compared to certain other medicines that we know cause blood clots. It's a little unfair to compare them all side by side, because you're also way more likely to get a blood clot from having COVID than to get it from a COVID vaccine.
Interesting.
One of the reasons that this one is so concerning is that the people who did have blood clots, it went into their head. So it's a certain kind of blood clot. So, you know, but for example, the comparison you'll see most of the time is with birth control pills. You're way more likely to get blood clots from birth control pills than the vaccine like this, but it's not quite the same, and it depends on what you've got going on, but relatively extremely low. I mean, we're talking about 8 people out of millions.
Thank you. We're going to head into vaccine effectiveness now. So can someone contract COVID between vaccine doses if they're taking Moderna or Pfizer?
Technically you can, you know, and or you could have picked it up right before you got the vaccine. So like when I had my temperature right after I had the first one, I did have to go get tested for COVID so we were sure that it was a vaccine reaction and that it wasn't actually sick and just bad timing. So it differs again based on the different vaccines, but after the first dose, you know, it may make you 50 to 70% protected or so. And then that second dose knocks it up to the 90s, 95 kind of ranges. And you're considered fully protected 2 weeks after the second dose.
Thank you. Can you get a COVID-19 vaccine at the same time as another vaccine?
Generally, we recommend that you don't. And so that's one of the reasons we recommend people delay. If they come in and they say, oh, I just got these vaccines, we might say, you know, we need you to wait a month until you get them. Or if you were sick with COVID and you got a special treatment that has plasma and antibodies against COVID, then for that one, we recommend people wait 90 days to get it, because that treatment, you know, might negate what the vaccine is trying to do. So there are a few health conditions that make you should delay, and those are 2.
Will this vaccine protect against the new strands, or those variants that you spoke of COVID-19?
And so far, fairly well. The studies with Moderna and Pfizer in particular have been that they cover those variants fairly well. So there's the Brazilian one, there's the one from England. Those are the most common ones we hear about or that we see here. You know, it's not 100%, but I think better than we initially thought that the protection would be. But again, as they're refining the science and understanding these new variants, you know, they'll make modifications so that it does fight whatever's out there at the time.
And then in terms of length of protection, we know that there's new updates coming out about how long, but about how long does protection from a COVID-19 vaccine last?
Well, and that's a great question. And I think we really don't know for sure. And that's something that we'll need to be learning together as a community. Is it going to turn out to be, something like measles where you need another booster, a couple of years later? Or is it something more like the flu shot where, the virus itself changes so much and so fast that you need a version every year? It could go either of those directions. But I think, if you think about it, this was just about a year ago now, and so much has been learned about this disease, this virus, how to fight it. We have, 200 million people vaccinated against it within a year. That's pretty amazing. So, we'll learn a lot together as a community too about the long-term risk questions that you're asking and about what do we really need to do to protect ourselves long term.
And you mentioned that the companies are continuing the studies throughout this process. So that's how we'll be learning this information, is through their continued studies of the participants of the original studies.
And new cohorts all the time, as well as the new age groups. There are other studies being added.
Continuing with effectiveness, will booster or annual vaccines be needed? I think we need to wait and see. What the studies show. So we'll move to the next question. If a person is vaccinated against COVID-19, will they be able to spread the virus to other people? This is an important one. They wanted to make sure we knew that.
Yes, and I agree. And that's, you've probably seen it in the news that nobody can say 100% no. And that's, that's the part that's concerning. And that's why, I would say if you're on an airplane, you still should wear a mask to protect yourself and protect other people. It is possible. It is so much less likely, but from scientists studying it, they're not saying it's impossible. So it seems that there is still a slim chance of that.
Thank you. And so you mentioned in terms of full protection from the vaccine, it's 2 weeks after your second dose, or in the case of Johnson & Johnson, where there's one dose, 2 weeks after that dose. And then for the last question, it's not really about better, it's about the effectiveness. And that was, you showed us that in that chart where you went through the differences between Pfizer, Moderna, and Johnson & Johnson. Anything else that you want us to consider in terms of which vaccine someone might end up taking?
Well, and I like the way Dr. Fauci talked about it in the beginning. The best one is the one that you can get, so that you're protected, which I think is basically true. I mean, if my daughter had access to one of them, I would get any of them for her. So I think, they have slightly different, if you have certain health conditions, there's some that you can get one and not another. And so, it may depend on that, again, at an individual level. Some people like the 2-dose ones because, the protection is a little bit higher, and that's a real thing. And so that's really important to a lot of people. Other people being able to have 1 dose and get on with it is the more important part, and their protection is still very good, especially against getting very sick. So it's a personal decision, but the statistics are out there of what's the coverage rate for the different vaccines.
Thank you. We're now moving into continued precautions. So do we need to wear a mask and avoid close contact with others if we are fully vaccinated?
So the recommendations, I would say on that one, keep an eye on the news, because it is constantly, new information is coming out. And as more and more people are vaccinated and more studies are done, we learn a little bit about that all of the time. What the general advice is now from the CDC, though, is if you're vaccinated and are around other people that are vaccinated, that you don't need to.
Thank you. You still have to quarantine if you are vaccinated and have been exposed to COVID. And then why do you need the vaccine if you already had COVID and are still testing positive for antibodies?
Right. 2 very good questions. And so for the first one, you still have to quarantine if you're vaccinated and exposed. That changes all of the time, and it depends to some degree on where you work, what state you were in, and where you went. So again, the quarantine has, the restrictions have lightened up around travel like a whole lot if you travel within the United States. But if you travel internationally, you still have to quarantine because your risk is, higher and higher for having variants and other things. But there's a lot of talk of if you have been vaccinated and you have that vaccine card, that the rules can be different. So, that brings up a lot of equity questions of not wanting to create a group of people that can do a lot of stuff who had more access to a vaccine, and then others who didn't have vaccine access who can't travel or, are essentially discriminated against. So, that's an important part of that conversation of what that vaccine card should allow you to do. But I think the more accessible the vaccine is to everybody, that everybody has an equal chance to get it, that helps that whole conversation too, because it is safer to travel if you've been vaccinated, and you shouldn't need to quarantine to the same degree if you've been vaccinated. For us at the hospital, it does put you on a different pathway for some of those things if you have.
Interesting. And then in
the
terms
second
of
part, right?
Thanks.
So this came up a lot early on, and this is why, for the most part, they don't recommend that you get blood tests to see if you have the antibodies, because if you got it from being exposed to COVID in the community, we don't know enough about if that does protect you. And we've seen enough people who have gotten COVID twice that doesn't protect you enough that you should skip that vaccine if you have access to it.
Thank you. If people express that they feel safe by wearing masks, washing hands, and distancing, and therefore do not feel they need to get the vaccine, what would you recommend or suggest we say to these people within our community?
Well, I think it's a very sensitive issue, and I think it's a very personal decision, and people need to get the information that they need to feel comfortable with the decision that they're making. And it's a big decision. My group vaccinated 1,000 people a few weeks back. And a lot of people came in and they were so nervous to get it, but they all had their reasons for getting it. Their families, somewhere they wanted to go. A lot of them were teachers and students that they wanted to be around. So it's everybody's decision. So I think it's important that they have access to good information. So I think helping people with that, if the information that's guiding their decision isn't real, isn't true, helping them to a better source can be good if they're receptive to that. CDC is good for that. Mayo Clinic has some great stuff. Johns Hopkins is a reliable source. The New York Times actually has a webpage that's always updated that has good information. So I think helping them really see those regularly updated and science-based resources can help. And I really do think the context is important. Again, you're so much more likely to catch COVID and get sick and die from COVID than anything that would happen to you from a vaccine. So I think that perspective is important, because some people, because it's not as obvious, think that it's not in our community anymore, but it absolutely very much is. But if people they're not ready to make that decision to get it, I think we have to be respectful to each other and of people's decisions that they're making, and respect people's time and space to make that decision. If they do make that decision not to get the vaccine, then absolutely the washing hands and the masks, they're incredibly important. And so that's not nothing, and that's great. If people who don't feel ready to get the vaccine yet are really vigilant about that mask wearing and the other things, that's great. That's important too.
Thanks, Dr. Gracie. The next 3 questions all have the same response. I'm just going to read them. They're around expectations for staff and scholars. So someone submitted who will be getting the vaccine. Will it be kids who are going in person that get the vaccine, or will it be online kids as well? Will this information be shared? Is there any expectation for staff who do not plan to get vaccinated in light of the rising concerns over Johnson & Johnson vaccine, which was just recalled? What options do we have to opt out of vaccinations and remain employed? And then will Equality give scholars the vaccine? Which one will they give? And so all of that information, at this point, the school has not mandated the vaccine for staff or scholars. We are awaiting more information from New York State, as well as the New York City Department of Education. As soon as we have information and can put our heads around any of that, we will continue to share that with our school community. But as of right now, the vaccination decision is a personal one for you to make with your family and in consultation with your medical provider. I'm going to turn now to look at the questions that were submitted during our webinar. And so someone asked, if I had COVID 7 months pregnant and they were 7 months pregnant, would my daughter test positive for antibodies?
You had COVID when you were 7 months pregnant?
Pregnant.
Probably not. But again, even if you did or they did, I wouldn't guide a decision about a vaccine on that. You know, so if you tested positive for antibodies and you've since had a child, or if your doctor still recommends that you're able to get the vaccine, I would still get it.
Yeah. There's a couple of questions here, so I'll go one at a time. Are any of the COVID vaccines FDA approved?
So not officially, and it's a subtle distinction, but they have an emergency use authorization. So you'll see that term EUA. And anytime that we give a person a vaccine, they're supposed to give you the official EUA that has all the information about that particular vaccine. So again, they have gone through very rigorous testing, like we talked about. You know, each of them had over 30,000 people in those studies. A lot of people have been tested. The manufacturing is highly regulated, and it's not that it was rushed or skipped, but it's still not quite that usual FDA level of approval. And so some of that and some of that process, they were allowed to expedite because of emergency situation.
Thank you for the transparency. One question is, what's the point in getting the vaccine if it doesn't present a cure? And you could still possibly get the virus or even possibly die from the vaccine itself.
So again, it's a matter of relative risk. You know, you're more likely to die in a car than on a plane, but we all get in cars all the time because it's important to us to do what we feel like we need to do and have the lifestyle that we want. You know, again, it's the vaccine doesn't cure it. And some of them, you know, none of them are 100% effective in preventing it. But again, they've all been really good for the people that haven't prevented it in, that they don't get as sick, not nearly as sick. And, you know, I think there was one death in the studies of like 40,000 people. So compared to, you know, 1 in 500 who have died, who've gotten COVID, it's not even in the same ballpark of risk. So I do think that even though it's not a cure, if it prevents it most of the time or prevents you from getting really, really sick from it, absolutely, it's worth it. You know, and again, I think with the Johnson & Johnson, it is scary and everybody should, you know, keep an eye on the news, get as much information as you can. But again, very few people after millions and millions got that vaccine. So very, very low risk, you know, lower than texting and driving and, you know, all of those kinds of things.
Thank you. Are poor Black, whites, and Hispanics getting different types of vaccines than Black, Spanish, and whites that are more wealthy?
In general, no. I think it was harder in the beginning when you had to have certain conditions to qualify for the vaccine or be certain ages, and you know, where was the vaccine distributed? What was the community acceptance of it? Did people want it? There were certainly communities where you couldn't get an appointment where it was delivered, and then there were communities where appointments weren't all filled based on community acceptance of the vaccine. And some of that's changed. A lot of people didn't want to be the first people to get it, but now that more people have gotten it, they're starting to get more and more comfortable. So I think it's really great and really important that now all adults are eligible, and you should be able to get it because it's broadly enough offered. And I think, you know, we're lucky that we live in this country and that we have access to it, you know, so much better than so many places, most places around the world. Is it exactly the same in poor neighborhoods versus richer neighborhoods? I think it probably depends. Luckily, the state and, you know, federal processes for getting the vaccine out there, they really did try to target community health centers, which are, you know, specially put into neighborhoods that are lower income. They targeted hospital systems who take care of people who are lower income and communities of color. So there were definite efforts to make it more fair. I think things probably aren't always completely fair, but I think the great thing, but there is no difference in what you should have access to. The Pfizer is the one that is harder to give from a community clinic. So that's the one, it has to be stored at really, really cold temperatures. And so it's just a little harder to manage. So that one, you're less likely to just have at your regular doctor's office. So if you live in a really rural area, for example, that might be a hard one for you to get access to. Whereas if you live in a city with big hospital systems, that's where you can get it more easily because they have the facilities to manage that. But with the other two, they should be broadly available. They still have to be refrigerated and they're only good for like 6 hours once you take them out, but it's regular refrigerator temperatures.
And I'll just say, I'll offer my mother as well as my 2 siblings and their significant others. We've all been vaccinated, and we live in the Bronx, in various parts of the Bronx, and we've had, some have had Moderna, some have had Pfizer, some have had Johnson & Johnson. It's just been what's been available at the site that we happen to sign up at. In terms of, I got the vaccine while breastfeeding. How quickly will my daughter get antibodies? Is that a possibility, and/or benefits from the vaccine?
So I haven't seen a lot of studies on that, but in general, if you get exposed to something or get a vaccination, your body can pass through breast milk, but it's not the kind that then she continues to have, your baby continues to have, and then is lifelong protected too. It's called passive immunity, that they sort of get it as a bonus from you while they're breastfeeding, but it wouldn't create lasting protection for them after they stop.
Thank you. And I do want to be respectful of everyone's time. So this will be the last question posed for the evening. We actually got through the majority of the questions that were submitted during this time. So if you die from the vaccine, is there any legal recourse, or do you have to sign something that protects those that administered the shot and hospital, so that if you take it and die, your family gets nothing?
That is an interesting question. I don't fully know, but what's required when we give the vaccine, is that we give you the information of that authorization, but you don't have to sign that when you get the vaccine card. So you don't sign any kind of waiver to it, but I don't know enough about it to be the right person to answer that question, unfortunately.
No worries. Dr. Gracie, I just want to take this time to recap what I heard you say, some important points. So we heard from you, we heard from Assembly Member Reyes, who is a nurse practitioner, an RN. Vaccines are overall safe, and they have been. And there is no COVID in the actual vaccine itself, whether it's Moderna, Pfizer, or Johnson & Johnson.
Correct.
Vaccines should help stop the spread, although there isn't definitive answers as to whether or not, if you are fully vaccinated, can you continue to spread COVID to other people. I heard you say that everything has risks. Medications have risks, getting a vaccine, has some risks, but the risk of contracting COVID and the possible impact of that is way more significant than the risk of being vaccinated. And then just in terms of some of the reasons why you suggested and are, in favor of yourself, you got vaccinated. You also are planning to vaccinate your 13-year-old child once that becomes available, in terms of, obviously supporting the overall community to try to keep others safe, to keep yourself safe. But also to engage in practices that were a little bit more like pre-COVID, right? Travel, getting together with family members and friends. And so anything else before we wrap up tonight that you want to share with our community? Any last words?
Well, you're an amazing moderator, and that was a better summary than I would have done myself. So that was fantastic. So thank you. And I think those are the really important points. I mean, I do think it is a very personal decision. I hope people don't get bullied or, excluded from things for not being ready to get it yet. I think, people have to arrive by that in their own time, and people have understandable wariness to get something that's new. I mean, that's a real thing. And I think we all have to be understanding and compassionate to each other and to choices that we each make. It's our families, it's our health, it's a big deal. So I encourage people to get your information from a reliable source. But absolutely, my personal recommendation is as a human, as a mom, as a doctor, as a public health person, is absolutely to get it, because the risk of getting COVID is so much higher and so much more devastating.
Thank you so much, Dr. Gracie, for joining us tonight. We really appreciate you. Again, thank you to Assemblymember Karina Reyes for your support in this. Jason, thank you again for joining us tonight. We appreciate you. I know that all of our participants that are on, thank you for staying with us through this hour. We want to let you know that there will be an email with a survey from the Bronx Borough President asking about questions that you have about the vaccine. He is very much wants to take into consideration any questions from his constituents. So that will be sent out. And again, we thank you for spending this evening with us. Everyone have a wonderful rest of the evening. Take care and be safe.